Why won't your groin pain go away? Thanks a lot for checking out the video. In this video, we're going to talk specifically about an adductor groin strain, how you might diagnose that yourself, why this pain lingers for so long for a lot of people and becomes very frustrating for them, and it won't go away even when they thought it had gone away. And we're also going to go through some of the exercises that we use here in the clinic for early stage, mid stage, and then late stage return to play. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. Okay, groin strains can be very, very frustrating. A lot of people, it hangs on for months or even years. Some people, it goes from one season into the next. It really affects your play, it affects your ability to train, and it can be a difficult one for people to get rid of. One of the main reasons why it doesn't go away is that people are unsure what to do. They do too much rest, focus too much on maybe stretching or soft tissue work, all these passive things that don't really increase the capacity of the muscle. And what we really need is to load this muscle more. It's fine to feel a little bit of discomfort doing it, but we have to increase the amount of work it can cope with. So most people stop too soon, don't do remotely enough, do a little bit, return to running, and then stop doing all the things. So this sort of rehab you need to work it really hard to get rid of that, and we're going to go through some of the exercises. So let's diagnose it first. So how you might know if you've got a groin strain. There's a couple of self-tests that you can do. You could compare one side to the other. So say with this first test, if I lie down on the ground here and I lift up this leg like this, and I'd done it with the other side, I could time it. You could get someone to push down on your foot and see if you're able to keep it up. And this might, after a few seconds or after a while, reproduce more pain or discomfort in your groin. You might notice a significant weakness from one side to the other. Another one you can do is if you go out into this position here, where you're on a little bit of a stretch and then push down through this foot. So push this foot down into the ground and drag it in towards you. That might reproduce your pain here. Again, you can compare that on the other side and see if that's no discomfort or whatever. Another test you can do, sitting down, fists here, and squeeze. And if you squeeze that for maybe 20 seconds, again, you might notice a weakness and a pain along the groin. A slightly more aggressive test for that would be to do it with a straight leg. So holding something like that in between your feet, and again, squeezing in together, you'll notice a little bit of pain and discomfort creeping along there. So they're the tests that you might use. Let's start with the early stage exercises that you're going to do to try and help this. The main ones at the start are all isometric exercises where you're getting the muscle to work without doing much movement. So if I sit down here, you can use, say for example, a foam roller or something like that, and apply a squeeze here. Holding that for about 10 seconds, take a break for 10 seconds and do maybe 10 reps of that. It's a low level squeeze, always under 50% effort. If you don't have a foam roller to use, you can sit down like this, put your elbow there, one here, and just do it that way and squeeze. But doing 10 reps of that of 10 seconds in it, that would be one set. The next version would be to straighten out your legs. And again, nice and relaxed, initiate the pressure in through your feet and ankles and maintain that effort. Again, let's go for 10 seconds for 10 reps. And always having the squeeze less than 50% effort. They would be some of the early stage exercises that you do, but the volume has to be quite high. So you might do 3 or 4 sets of those 2 exercises, and you might do 2 or 3 days on and then take 1 day off. As you move on to the next stages, we will still use these isometrics, maybe more as a warm-up, but they'll definitely still be in your daily and your weekly plan. In the second stage of exercises, we're going to move on to more dynamic movements where the muscle is actually working through full range. Now, to know when you can move on, you should be able to do some of those self-tests again and notice an improvement. Much less discomfort and not that same feeling of weakness. Then you know you're ready to move on. So let's go with some of the second stage exercises. So here, wrapping a band around something, shoulder, hip, knee all in one line here. And what I'm doing is bringing this foot in across my body, across the other foot. So lift it up off the ground about 1 inch and bring it across your body like that. Now, as I'm doing this exercise, I need to feel it working here. It's actually quite good because a lot of people can have pain on both sides, and this works both groins here. So we're going to repeat this on both legs. So I'm not coming back like this, I'm staying on this side and I'm bringing this across my body. Now, Again, another mistake most people make is they do 10 or 12 or 15 of these. Really what you need to do is go to the point where you could only do another 2 or 3 repetitions. You might have to do 30 repetitions. It should be an effortful exercise and you should feel that area working. If you can't get it like that, straighten up your body, change whatever you need to change in order to feel this muscle working here. The second exercise you'd pair with that is to go in this position. Again, pushing down through this foot, and I'm driving this knee up. So controlling it back into this running action here. And again, that's going to work more of your hip flexor, but your groin is involved in bringing your knee up and down, so it needs to be done like that as well. Again, don't stop at 10 or 12 reps. That needs to be done till it's really effortful. You might be up at about 30 reps. So pair those two together and do them on both legs. It's a really, really tough exercise for that mid stage. Another one you can do is, this works better if it's a timber or tile surface. Staying like this, put a little bit of downward pressure through this foot and you're sliding your foot out and back in. So I'm pushing down through this foot, maybe only 20%, and I'll maintain that for about a minute. Do it on both sides, and again, it's getting that groin to lengthen and shorten with some work happening in the muscle all the time. So those few exercises, you might do 3 sets of all of that. You might warm up with the stage ones and do 3 sets of all of that, and that puts that area under quite a bit of work. Into the last stage of exercises that you might use. You would probably still do some exercises from stage 1, stage 2 to really warm up and work the area, but then we're moving on to quite a difficult exercise called the Copenhagen exercise, which I'll do first, and then we're going to go into some skater jumps. So the first level of Copenhagen that you will do will be with a bent knee. So if I lie down on the ground here and I get into this position, my knee is on the bench, I'm pushing down through my knee, hip, shoulder all in one line. I'm trying to push this up to the ceiling. Pushing down through the left knee, holding it here for 10 seconds, and then I'm going to drop it and bring in some dynamic exercises. So I drop my hip down, push through my left knee, and again I'm working this groin here. So that would be a half Copenhagen, which you would need to be able to start with. That should be effortful, but not be causing pain. It should work the muscle quite a bit. The next level of that, if you're able to do the half Copenhagen, is to go into a full length Copenhagen, which is just a much longer lever, so it's more stressful on the groin. It's this exercise here. So again, trying to get this up to the ceiling, pushing down through my left foot, hold it for 10 seconds, and then going into these dynamic exercises. Trying to get this down and up, and that puts a lot of work here. Again, you would repeat both of these exercises on both sides, and there shouldn't be a difference between one side and the other, okay? The last set of exercises then we'll talk about are the more dynamic exercises where we're going into your skater jump. So you're pushing side to side, not staying on the ground very long, but most people who suffer with groin injuries need to get back to a sport where they're running and jumping, twisting and turning. So if you do that for 30 seconds, take a break, repeat. And another way of doing a dynamic exercise here is we're going into these lunge jumps with rotation. You can hold a ball and again repeat 30 seconds on, 30 seconds off. So they would be the latter stage ones, the Copenhagen and those dynamic exercises. When you return to play, you would still need to warm up really well before your activity, probably 15 minutes of specific work on your groin area. Certainly the exercises with the red band, maybe an isometric, maybe going into a little bit of the dynamic exercises. And once you return to play, that needs to be continued for probably 6 months to keep this injury at bay. If you have any questions, let me know. Keep an eye on other videos, make a comment, and we'll be glad to help you out.